Let us now compute for the blood alcohol level if we have patient in the ER who manifested for intoxication or let's say withdrawal. Then we have no uh, alcohol breathalyzer test, so we might estimate the blood alcohol level using the formula. So this is the clinical features of intoxication at a certain blood alcohol level. If the patient have a 50 milligram per dl or less, the patient will manifest these following symptoms like talkativeness, feeling of well-being. 50 to 100 milligram per dl, mild intoxication. 100 to 300 milligram per dl, moderate intoxication. Patient would show slurred speech, muscular incoordination, slight visual impairment, diplopia. So driving is impaired here, and 300 to 500 milligram per dl, severe intoxication. Greater than 500 milligram per dl, patient is in coma or in respiratory failure. So patient with blood alcohol level of 0.05% as measured in the alcohol breathalyzer test, it is 50 milligram per 100 ml, are considered medically intoxicated. We have a case here, a 10 hours prior to consult, a 40-year-old male patient, 55 kilograms, 400 ml of Gelbis gin with 40% alcohol content. He was then brought to ER because of seizure 8 hours after ingestion of the gin. So the ER physician's diagnosis is alcohol withdrawal seizure. Question: what is the blood alcohol level of the patient at the time of examination if the toxicokinetic clearance in patient's case is 30 milligram per dl? So we have the formula for calculating the blood alcohol level. ml ingested times the percent of alcohol times the specific gravity of ethanol, which is constant 800 milligram per ml. Then the volume of distribution for adult, we use 0.6 liters per kilogram. For children, 0.7. The weight of the patient and times 10. This is a constant to convert the liters to DL. So 1 liter is equivalent to 10 deciliter. So let's compute basing on this case. So here we had a blood alcohol level 400 ml Gelbis gin at 40% alcohol times the specific gravity divided by the volume of distribution, which is zero point 0.6 and 55 kilos and 10. So you might eliminate this one kilograms. So what will remain is DL because the liters will also be crossed out. So here you cross the ml. So what will be left is milligrams and DL. So blood alcohol level of the patient is 387.87 milligram per DL or 388 milligram per DL. So alcohol clearance after 10 hours because the patient was examined after 10 hours. So the um, it was given that there is a clearance of 30 milligram per dl per hour. So here 30 milligrams per dl times per hour, so times 10 hours at the time of examination. So 300 milligram per dl will be cleared. So 388 milligram per dl upon ingesting 400 ml of the gin minus 300 milligram per dl after 10 hours. So after 10 hours, the patient's alcohol blood level is only 88 milligram per dl. So maybe patient is a chronic alcoholic drinker because he had seizure. So maybe an abrupt fall of the alcohol level. So this is a withdrawal seizure because only 88 milligram per dl and the patient had a sudden um, stimulation or excitatory manifestation. So that's it. Thank you.